Welcome! Today, we are diving into one of the biggest challenges in dentistry. You have a patient with no teeth. How in the world do you build them a perfect bite? It's a fascinating puzzle, really a mix of art, science, and just a deep understanding of how the body works. So, let's jump right in.
So, this is the fundamental problem, right? With no teeth, there's no natural guide, no stop for the jaw. We literally have to create the patient's ideal bite completely from scratch. We have to figure out the right height and the right position. It really is like trying to build a house without a foundation already in place.
All right, first things first. Before we can do anything else, we have to establish the right height for the lower third of the face. We call this the vertical dimension, and it is the absolute bedrock for everything else that follows. So let's lock in this term. Getting the vertical dimension right is so critical. You know, if it's too high, the patient's muscles are going to feel strained, and their new teeth might even click when they talk. But if it's too low, their face can get that sunken-in look, making them appear older.
Okay, so to nail down the perfect height, we actually take two key measurements. The first one is the vertical dimension at rest, or VDR. This is exactly what it sounds like. It's when the jaw is completely relaxed. The second is the vertical dimension at occlusion, or VDO, and that's the height when the teeth are actually biting together.
And this diagram here really shows you how those two measurements connect. You can see the jaw's resting position, our VDO, is always a little bit taller than the biting position, the VDO. And that little bit of space between them, well, that's super important. And that space has a name. It's called freeway space. Now, it's only about 1 to 4 millimeters, but it is absolutely crucial for letting the jaw muscles relax when a person isn't eating or chewing. You can think of it like the neutral gear in your car. Without it, the muscles are always firing, which leads to fatigue, pain, and sometimes that annoying clicking sound.
Okay, so we've got the height figured out. Now we have to find the correct horizontal position for the jaw. This is all about finding the jaw's true home base, its most stable, repeatable, and comfortable spot.
And this home base is what we call centric relation. It's a really specific spot where the jaw joints, the condyles, are perfectly seated up in their sockets. Because it's the most stable and repeatable position, it's the perfect reference point for us to build from. So why is centric relation our absolute go-to? Well, because it's a relationship between bone and bone, the jaw and the skull. It has nothing to do with where the teeth are. And of course, in a patient with no teeth, this bone-to-bone relationship is the only reliable, stable landmark we have to build a bite from. Finding this exact spot in a patient can be, well, a little tricky. But thankfully, there's a really cool technique that actually lets the patient's own jaw movements pinpoint the location for us.
This is the Gothic arch tracing method, and it is seriously clever. We use a little device with a tiny pin and a plate inside the patient's mouth. And as we guide them to move their jaw around, forward, back, side to side, that little pin actually draws a tiny arrow shape on the plate. The very tip, the apex of that arrow, is our target, centric relation. It's just a fantastic way to get a visual confirmation.
All right, so we've captured our two most important puzzle pieces, the vertical dimension and centric relation. Now, we have to get all of that precise information from the patient's mouth to the dental lab, which is where the real magic of making the dentures happens. And this is where the Facebow comes into play. You can think of it almost like a 3D compass for the face. It records exactly how the patient's upper jaw is oriented in space relative to their jaw joints. This lets the lab set up the models on their equipment in the exact same orientation, essentially creating a perfect working replica of the patient. Now, there are basically two flavors of Facebow. The arbitrary Facebow is the one we see most often for complete dentures. It's simpler and uses landmarks like the ear canals to get a really good approximation. Then you have the kinematic Facebow. This is the high-precision version. It finds the patient's exact rotational hinge axis, but it's more complex, so it's usually reserved for more complicated full-mouth rehabilitation cases.
So all of these careful steps we've talked about, getting the vertical dimension, finding centric relation, and using the Facebow, they are all building towards one single, ultimate goal for the new dentures. And that goal is something we call balanced occlusion. It's a fancy way of saying that when the patient chews or moves their jaw side to side, the teeth on both sides of their mouth stay in contact. This is absolutely essential for keeping the dentures stable and preventing them from rocking, tipping, or even popping out during function. Now, to create this perfect balance, we have to juggle 5 interconnected factors. In the world of prosthodontics, these are famously known as Hanau's quint. You can think of them as the 5 golden rules for getting this right.
Here they are, the 5 factors.
The first one, condylar guidance, is just the unique path the patient's jaw joint takes. That's fixed. We can't change their anatomy. But the other four, the angle of the front teeth, the tilt of the whole bite plane, the grooves we build into the arch, and even the steepness of the cusps on the teeth, those are all variables that we as clinicians can control to create a perfect, harmonious bite.
So think of it like a balancing act. This formula here really just shows that all these factors are interconnected. If you change one of them, you have to adjust the others to keep the whole system in equilibrium. It's a delicate dance between the patient's anatomy and the prosthodontist's design.
So as you can see, making a great set of dentures, it is so much more than just making teeth. It's about creating a prosthesis that is in perfect harmony with the patient's entire system, their muscles, their joints, everything. It's about giving them back not just their smile, but their comfort, their function, and really the confidence to enjoy life again. And that, of course, brings us to the future. With digital workflows and AI becoming more and more common, how will these foundational principles adapt? The tools are getting smarter, no doubt, and the workflows are getting faster, but that fundamental challenge of recreating a perfect, balanced bite from nothing, well, that remains. It's a very exciting time to watch how this